Hey, I'm Dr. Dell. If you've ever had an injury like this or back pain in general, then this is the place for you. Whether it's a muscle strain on your lower back or a disc injury or something else entirely, identifying the root cause of your problem is the first step in recovery. In this video, we're going to be discussing the 5 most common types or causes of back pain so you can stop guessing what it is and start healing with us. Hi, I'm Dr. Dell. I'm the chiropractor and clinic director here at Kaiser Health in Fort Washington. We've helped thousands of patients eliminate their lower back pain. The first injury that we're going to be discussing is the muscle strain. It's important to understand what a muscle strain is in the first place. The muscles and ligaments that support your lower back become damaged either through an overuse injury or lifting a heavy weight or sudden unguarded movement. Here is a diagram of the paraspinal muscles of the spine. When there's an injury to the muscle tissue or ligaments, the muscles are usually tight, you're unable to move properly or do your activities of daily living correctly. One of the most common questions we get is how do you know it's a muscle injury versus something else? The main differences that can determine a muscle injury versus something else, like a spinal stenosis or lumbar disc injury, are as follows. Typically with a muscle injury, you have pain on any kind of movement or against resisted motion. With a disc injury, you may have pain in one form of movement, but better with another form of movement. You may also have radiating pain or sciatic pain going down the legs. With stenosis, you might have pain walking for prolonged periods, but better with rest. So there's just some nuances that you would have with a muscle injury versus something else. The last way you would tell a muscle injury versus something else in your back is the time that it takes for the pain to go away. Typically with a muscle injury, you're only having pain for a couple days or a couple weeks. With a lumbar disc injury or something else, you may have the pain for much longer. My 3 biggest pieces of advice if you do have a muscle injury: number 1, come see us. Get evaluated, get the proper treatment, the chiropractic care, and the physical therapy. Number 2, I would stop doing any kind of strenuous physical activity or heavy lifting. And number 3, I would rest, ice, and stretch the back with the exercise that we show you in the clinic. Another common reason a patient would come to the chiropractor for low back pain is related to a herniated disc or disc bulge. So I got my spine model here, and I'm going to be showing you what exactly a herniated disc or disc bulge is on the spine. So the most common areas to get a herniated disc is L4, L5, and L5S1. We can actually see an illustration of a disc bulge. And so what happens is you have 2 main areas of the disc. You have the nucleus pulposus, which is like the jelly filled center of the disc, and then you have the concentric rings around it called the annulus fibrosus. And a herniated disc, the nucleus pulposus will actually ooze out the side of those concentric rings, and it may or may not push onto a nerve and give you pinched nerve symptoms, pain going down the leg, excruciating lower back pain, muscle spasms, restriction, something like that. So how would one know that they have a herniated disc or a disc bulge injury or pain related to those type of things? So a patient would usually present with a sudden unguarded movement injury. Maybe they're bending down to pick up something and they feel a sharp pain in their back. Maybe they're lifting something at the gym, doing a deadlift or a squat. Usually the form is not optimal, so they might injure their back. Or they might be an older patient or someone who's worked a really hard job, like a construction worker, police officer, or firefighter. They might have degeneration in their back. By degeneration, I mean that if we look at these discs again, there tends to be wear and tear abnormally, again, in the lower lumbar spine. As you age, these discs tend to thin out, and there might be uneven pressure one side or the other. The disc will inflame because the body's trying to heal itself, and in doing so, it'll start to push on those nerves as well and cause pain in the back or pain going down the leg. So another question I get is, what can I do about a herniated disc or a bulge or some kind of injury like that? Do I need surgery right away? The short answer is probably not. You need to go see me at the chiropractic office here in Fort Washington. First thing you need to do is do not ignore the pain. You need to come and get evaluated and look at what type of injury you have. We might refer out for imaging, whether it's an x-ray or an MRI, especially if you're having that radicular pain down the leg. But we would do an evaluation, we would see how you're moving, and a lot of times conservative care can treat a disc herniation or disc bulge. The biggest thing I tell patients is don't always be wrapped up in pain. Eventually your pain will go away, but your functioning will not return, and that's why you need to come in, get evaluated, get the adjustments, and get the physical therapy. Another common reason that a patient would have low back pain or come see me is due to degenerative disc disease. And I always call this the silent killer because this is a condition that is over time, you may not feel it, but you might do some certain thing. You might get up a certain way, you might get out of your bed a certain way in the morning, and then feel like, where did all this pain come from? Degenerative disc disease takes years. It can be accelerated through a car accident injury. It can be accelerated through a lifting injury that never gets fully addressed, or it could just be over time. Again, especially if you have a desk job or you're sitting long periods, your posture might be off, or you work a physical job like a construction worker or firefighter. Just over time, the gravity takes its toll and it can start to wear down the spine. Common signs and symptoms of degenerative disc disease. Again, like I said earlier, it's a slow and gradual process. So you might not know it right away, whereas like a disc injury, you might bend down and feel the pain, feel your back lock up. Degenerative disc disease, you might feel it in the morning when you first get up, you're a little stiff and sore, it takes you a while to get moving, or you might feel it worse at the end of the day, especially if you're sitting for long periods. Arthritis is generally improved with movement and heat, and I do recommend that people exercise. They might have more pain with the arthritis or degenerative disc disease, but generally speaking, the more you move, the better you're going to feel with the degenerative disc disease. The less you move, the worse you're going to feel. Another common reason, and probably a more serious reason that somebody would come in for back pain, would be related to spinal stenosis. Generally speaking, it is a degenerative condition, meaning that you get it later in life. We see it in our older patients, but not all the time. So you can get stenosis for two main ways. One is the way that I just discussed, where the spine starts to wear down a little bit. You have a little bit less space where the nerves come out of, the intervertebral foramen, and that might cause narrowing around the nerve and pinch the nerve and give you some symptoms related to a pinched nerve. The other way you can get stenosis is through a disc injury. So if the disc starts to bulge and it starts to inflame, or you have a full-blown herniation that starts to pinch on the nerve, you may have a narrowing situation that will cause lumbar stenosis and those symptoms. People with stenosis do not like to extend or stand for long periods, so they tend to want to sit down shortly after they're standing or walking. Increased walking or standing will start to cause pain down the leg called neurogenic claudication, but not all the time. But generally speaking, patients with spinal stenosis like to be sitting and like to be in a flex posture. The main treatment for spinal stenosis always starts with an evaluation. So again, come and see me and we can get an x-ray and confirm this. A patient with spinal stenosis would probably have lower back pain and pain going down the affected side into the leg. They may also have a more serious condition called equine syndrome. That's rare, but if it is happening, you need to go to the emergency room for that. Most of the time, that's not the case. They might have other symptoms related to the stenosis, but it always starts with imaging. And once that is confirmed, we want to get the patient exercising. We want to get them adjusted so the spine is moving, and we also want to strengthen the core. If it's a more serious situation or they're not improving with the treatment, we might want to have another type of doctor involved, whether an orthopedic surgeon or a neurosurgeon. Again, it depends on the severity of the symptoms. Another common reason somebody will come in with general back pain is due to posture. They might not know that it's due to posture, but the more you talk to them about it, the more they talk about their history, you can kind of figure that out. So a patient with postural syndrome, they'll tend to have rounded shoulders or anterior head carriage. They might even have a kyphosis in their back, meaning they're a little bit hunched forward, and they usually have a desk job. They're sitting, especially if they're working from home. They might feel worse towards the end of the day. They don't feel too much pain in the beginning, and that's again because they're sitting for long periods. I would always recommend that a patient get up every hour or so and walk around, not only to help with their back pain, but also to clear their mind, especially if they're working on the computer. They might just get bogged down. So if you need to, I would even set a timer on your phone or some other device where every 1 to 2 hours you're getting up to take a quick break to stretch and rest for about 5 minutes. So one of the best exercises to do if you do have a posture syndrome, after you've seen me and been evaluated, one of the best exercises I'm going to give you is called the chin tuck with scap retraction. So what you're going to do, you're going to find a door and you're going to stand in the threshold of the doorway. you're gonna stand with the back along the frame here, and you're gonna do a chin tuck first. So the key with that, bring the chin back. Do not bring the chin down. Bring the chin back. While you're bringing your chin back, have your arms 90 degrees and squeeze your shoulder blades back. Hold for about 1 to 2 seconds. Make sure you're breathing, and then relax. Then reset. Start with that chin tuck again. Squeeze the shoulder blades back for 1 to 2 seconds, and repeat. I would recommend about 1 to 2 sets of these, 10 repetitions with that 1 to 2 second rest or stretch in between. All right, that's it. Thank you so much for watching. This is Dr. Dell with Kaizo Health in Fort Washington. If you liked the video, feel free to leave a comment or subscribe to our channel.